A felon is a deep space infection of the compartments of the fingertip pulp. Management of these lesions can be tricky. Generally, they involve incision and drainage, and there are a lot of different methods out there that have been described in terms of where to place the best incision. In this video, I'll describe a variant on the bilateral lateral incision technique called the through and through incision technique. To prepare for this procedure, make sure that you've well anesthetized the finger with a digital block, that you have a tourniquet in place for good hemostasis, and that you've prepared the finger with antiseptic solution and created a sterile or at least aseptic field. You'll make your initial incision laterally with a number 11 scalpel blade. Be mindful that this type of incision does run the risk of injuring the digital nerve and artery. As you see with this incision, copious amounts of pus have already started to drain spontaneously from the finger. It's advisable to obtain a wound culture in the case of a felon incision and drainage. Generally, these are due to staph infections, but it never hurts to have this data for follow-up in case it's not healing properly. Next, you'll take a hemostat to break up those loculations and break up the septations within the compartments of the fingertip pulp. After this, you'll proceed to turn your attention to the other side of the finger and make a similar incision with an 11-blade scalpel, basically mirroring the incision on the other side of the wound. You'll again take hemostats to explore, and this time even try to connect those two spaces that you've created on either side of the wound, because your goal will be to feed some sterile packing through and through the wound. Once you've connected the spaces, go ahead and place your hemostat through and through the incisions. You'll want to use a sterile piece of packing or a Penrose drain or another inert material to feed through and through the incisions that you've made. The easiest way to do this is to go ahead and place it within the jaws of the hemostat and then go ahead and pull them straight through the wound in order to stent open those through and through incisions and to create a conduit for continued drainage from the felon. As with the treatment of all felons, you'll want this patient to have follow-up in a minimum of 2 to 3 days, at which point the wound can be re-examined, the culture can be followed up, and additional treatment of the felon can be performed as appropriate if it's not healing. One final step, make sure to remove that tourniquet and to ensure continued hemostasis. Again, remember, you run a little bit of risk of injury to the digital arteries when you create this type of incision. To learn more about treatment of felons and other basic and advanced procedures in wound care, visit www.lacerationrepair.com.